Hi everyone, I am Dr. Professor Sibani Mazumder, Professor and Head of the JMN Medical College, ex-Professor and Head of the Calcutta National Medical College. Now today I will show you how you can prepare for examination in the Viva. I think how will you overcome the Viva?
I am with MBBS student from Calcutta National Medical College and Hospital.
Now pick up the heart and hold it in anatomical position. What are the points for holding it in anatomical position?
Because we can see the apex of the heart, which is projected forward, downward, and we can see the base of the heart. Formed by the right and the left atria.
And you will also show me the different surfaces of the heart.
Okay. So there are three surfaces related to the heart. One is the sternocostal surface. And we can see the flat diaphragmatic surface, and we can see the left surface of the heart.
Good. Now you identify the different surfaces and the borders of the heart.
Okay. So we can see, the heart consists of three surfaces and three borders. We can see, if I hold the heart in anatomical position, it is the sternocostal surface. We can see the sternocostal surface. And we can see this flat surface, that is the diaphragmatic surface, and it is the left surface of the heart,
which is more convex. Show me the different borders.
Okay. So the first is the right border. So it is the right. So if we pass this probe through the superior vena cava, it will come out from the inferior vena cava. You can see.
And that is the right border of the heart.
So
that is formed solely by the right atrium.
Yes. So we can see it is the left auricle, and it is the apex of the heart, which is actually formed by the left ventricle. So from the left auricle to the apex of the heart, we can see the left border, and we can see the unnamed border.
Good. Now you show me the atrioventricular sulcus.
So we can see the atrioventricular groove. Yes. So this is the atrioventricular groove.
So it begins from the right side. Anteriorly the groove is deficient.
Yes.
It is C-shaped groove. So that's why deficiency is due to the ascending aorta and the pulmonary trunk. Now you show me the posterior part of the atrioventricular groove.
Posterior part of the atrioventricular groove. Yes.
Good.
Yes.
That is the posterior part of the atrioventricular groove.
Yes.
What structure you will get here in the posterior part of the atrioventricular groove?
Posterior interventricular branch of the right coronary artery and the middle cardiac vein.
And here there is the posterior you will get here the anastomosis between the two coronary artery, and you will get here the coronary sinus.
Yes.
What is the length of the coronary sinus? This is approximately 2 centimeters. Now you show me the anterior interventricular groove.
So if I hold the heart in anatomical position, it is the sternocostal surface of the heart. It is the anterior interventricular groove.
Does it groove like? It looks groove like?
Yes, it is groove like. We can see it is groove like.
Now what structure you will get here?
So we can see the anterior interventricular branch of the left coronary artery and the great cardiac vein which drains into the coronary sinus.
Good. Then you show me the posterior interventricular groove.
So if we observe the diaphragmatic surface of the heart, it is the posterior interventricular groove.
And what structure you will get within it?
Posterior interventricular branch of the right coronary artery and the middle cardiac vein.
Good. Now you tell me, show me the apex of the ventricle.
It is the apex of the ventricle.
Now this apex, where it is situated within the body?
So the apex of the heart is located in the fifth intercostal space, 9 centimeter away from the midline, and the apex of the heart is projected downward and forward.
Now the left fifth intercostal space,
Yes.
because the heart apex is directed towards the left. Now what is the size of a normal heart?
So the size of a normal heart is like the closed fist.
One closed fist. Good. Now you will tell me what is apex beat.
So apex beat is the downmost and outermost site of definite cardiac pulsation.
And which one can feel by means of their hand.
Yes.
That is the apex beat. Good. Now you show me the inferior border of the heart.
Inferior border of the heart. So actually inferior border is separating the sternocostal surface of the heart from the diaphragmatic surface. So it is the inferior border of the heart.
That is from the apex up to the orifice of the inferior vena cava.
Yes.
So that is the inferior border of the
Yes. It is orifice
heart.
of the inferior vena cava. We can see if I pass through the probe.
Show me the arch of the aorta.
It is the arch of the aorta.
What are the three branches you can see here?
So we can see the right brachiocephalic trunk, left common carotid artery, and the right subclavian artery.
Left subclavian
Left
artery.
subclavian artery.
Okay. Tell me what are the position of the heart within the thorax?
So the heart is located in the middle mediastinum.
The medial mediastinum, and 2/3 of the heart is on the left side and the 1/3 is on the right side. Good. Next, can you show me the position of the transverse pericardial sinus?
So
Transverse pericardial sinus, show me.
okay. So if we pass through this probe in front of the superior vena cava, so it is the transverse pericardial sinus.
That means in front there lies pulmonary trunk and ascending aorta,
Yes.
and behind lies the upper pulmonary vein. So this is an intervisceral space
Yes.
where we will search for the that is the oblique pericardial sinus.
So it is the apex of the heart. So if we are capable of locating the apex of the heart, so we can see it is the oblique pericardial sinus.
After lifting the apex, you can localize the oblique pericardial sinus. Good.